So thanks for joining me today. I'm going to be talking all about the importance of pelvic floor and perineal massage in preparation for birth. So most of you who are pregnant in your third trimester may have already heard about perineal massage. And there is good quality research coming out now to suggest that perineal massage can help reduce your risk of perineal tears and risk of needing an episiotomy. So I want to go through and talk a little bit about what the research suggests and why that might be the case. And also talk a bit about the pelvic floor, which I think gets so much forgotten. The perineum is the small amount of tissue that runs from the vagina to the anus, and it's a very small body of tissue. Now, the perineum is the little bit of tissue running from, as I said, the perineum, it runs from the vagina to the anus, and the perineal body makes up a percentage of that space. And then as you come further towards the anus, so imagine 4 different sections. You've got the perineal body, which can tear. That's often a first or a second degree tear, is all the way to the end of the perineal body. And then it turns into the external anal sphincter. Now, the external anal sphincter is a voluntary muscle. It's musculoskeletal tissue, and it is the muscle that we use to control when we need to pass wind, or if you are trying to hold on to a number 2. The internal sphincter muscle, which is a circle around the anus, a little bit deeper than the external anal sphincter, is smooth muscle. So this muscle is almost like the heart muscle. It is a smooth muscle that functions automatically, and it's not under voluntary control. Now, when you get the urge to pass a bowel motion, this is the relaxation of the internal anal sphincter, which is that smooth muscle tissue. You can then hold that urge by contracting your external anal sphincter and your pelvic floor in order to make it to the toilet on time. Now, during a vaginal birth, what can occur is a tear anywhere from a 1st to a 4th degree perineal tear. So as I said, if you imagine these 4 layers, the 1st degree tear is a tear to the perineum, but only a portion of the perineal body. The 2nd degree is all the way through to right on the edge of the perineal body, the lining of where it meets the external anal sphincter. A 3rd degree tear is where it has started to tear through the external anal sphincter. And so in your rehabilitation, it's really important, if you have a 3rd degree tear, to make sure that you're strengthening those muscles. A 4th degree perineal tear is where it tears all the way through to the internal anal sphincter, which is that smooth muscle. Now, the reason that can be so detrimental is, as I said, this smooth muscle is what helps us to control the urge, as well as this external sphincter. So if you have a tear to the 3rd or 4th degree, you may have some loss of fecal incontinence, some loss of fecal continence early on postpartum, which of course we absolutely want to avoid at all costs. So instead, what your midwife obstetrician may do is perform an episiotomy. Now, an episiotomy is an incision where they cut through to the side. So imagine, I don't have my pelvic floor model on me, but if you imagine your vagina and your anus, so 2 holes and then a body of tissue running in between. Now, that body of tissue, there's 2 circles around your anus, the internal and external anal sphincter. So if you tear all the way from your vagina to your anus, that is going to create that tear in those muscles. However, if there is an incision completed to the diagonal of that perineal body, you will significantly reduce any risk of compromise to the internal or external anal sphincter. So this is often a preferred case, which is why a obstetrician or midwife may well decide to perform an episiotomy. Now, there are growing number of research papers to suggest that perineal massage, and I think pelvic floor release as well, can help reduce this risk. So now that you have a bit more of an understanding of what perineal tears are, what degree perineal tears you can have, as well as what and why they actually do an episiotomy, let's talk about releasing the perineum. So if you imagine, as I said, that little bit of tissue running from the vagina to the anus is the perineal body. And the elasticity in this tissue can be increased by gently stretching. And there can also be an increase in the pain response of pressure to that tissue. And this is where the pelvic floor stuff comes in. If you imagine Bub's head starts crowning and all of a sudden there is this quite significant pressure down on the pelvic floor, requiring the pelvic floor to stretch 300 times its resting length and requiring this perineal body to stretch significantly as well without tearing optimally. So when you first start to get this stretching sensation, a message will be sent to the brain to look for what has happened or what's felt like this stretching sensation in the past. Now, if you have had any sort of trauma, now this could be endometriosis and recurrent painful periods, it could be recurrent thrush infections or urinary tract infections causing a general irritation around the vulva. It might be a history of sexual trauma or falling off a bike or a horse, or even snowboarding straight onto your bottom, where you've had that direct trauma to the coccyx and it's caused that tightening of the perineum, but also the pelvic floor. Then this message is going to get sent to your brain looking for what's happened like this in the past. Is there any reason to be threatened or concerned? A signal is then going to be sent back to the pelvic floor, depending on what the response is, to say contract, protect. And this all comes down to pain physiology. So I love to tell two stories. I love stories if you haven't already met me. But the first story I like to tell is from a pain physiotherapist, and it's actually his personal experience. His name is Lorimer Mosley, and he's a pain researcher. He was walking through the bush in Australia and felt something brush up against his leg. Message got sent to his brain. What's happened like this in the past? Is there any reason to respond with threat, with pain? Message gets sent back down. No, only a twig. So he is in no pain. He thinks, oh gosh, that was a strange sensation, and then looks down at his leg only to realize that he has been bitten by a snake. After this, he gets rushed to hospital, given an antivenom, and he thankfully survives. But a year later, he is again walking through the bush and feels something brush up against his leg. Message gets sent to his brain. What's happened like this in the past? Is there any reason to respond with tightness, with trauma, with pain, with threat? Threat, alarm bells go off. He gets a signal to his leg. He drops to the ground in excruciating pain, crying in pain and absolute agony. And then he looks down only to discover he's just been brushed up against a twig. So you can start to see how past experience, past trauma, or any past experience that's held in the subconscious or in the brain is going to create a response equal to that level of threat. So pain is actually the body's response to threat. And there's lots of studies in pain science that have actually looked at our brain's response to perception of threat. So they've done studies where someone's had their hand in a box and there's a mirror on one side and then there's a fake arm there, but it looks like it is their arm. So it's an image of their arm. And then essentially they insert a knife into the top of the fake arm, but from their perspective, they're looking at this arm with a knife being put into it, and they actually start screaming in agony. And it's because they're seeing visually a massive amount of threat to their body. So they respond with pain, even though their arm has not been touched. So if we come back and start to think about the application of this in terms of the pelvic floor and perineum, if we can think about what impact this is going to have, it's going to create this response of trauma if there is a response of trauma in the physical body, then it's going to have this response. So if you imagine Bub's head starts crowning, there's a stretch on the pelvic floor in the perineum. Then what happens? Message gets sent to the brain. What's happened like this before? If the brain says, oh, this just feels like a stretching sensation, I'm used to this sensation, I've done perineal massage with my partner, it sends down a signal and says, this is discomfort. It's not comfortable, but it's not threatening. However, if you've had some sort of history of any trauma, as I spoke about, the message is going to be very different, and it's going to send a message of threat. Your body is going to respond with pain. You're going to tighten up to protect the area. So if you imagine your pelvic floor will start to tighten up, and this is actually the opposite to what we need and what we want during a natural vaginal birth. So this is why perineal massage is so important. It teaches the brain that there's no threat. It teaches the brain that this stretching sensation is safe, and that it doesn't need to respond with pain, and it doesn't need to respond with tightening. Now, if you imagine the pelvic floor is kind of like a horseshoe shape, and it sits on the whole floor of the pelvis. So it's a group of muscles and connective tissue running from the pubic bone at the front to the tailbone at the back. And the perineal body is that small amount of tissue running from the vagina to the anus. So I want you to imagine the perineal body is a very small amount of tissue compared to the whole stretching of the pelvic floor. And not only can we hold tightness and tension or trauma or have some lack of elasticity in that muscle in the perineum and the external and internal anal sphincter, but that can also occur through the whole pelvic floor. So it's important to look at the big picture. The perineum gets so much attention, and I think it's mainly because it's what you see tear. So it's what's actually fixed on the outside. The pelvic floor can certainly tear as well, but it's only becoming more and more well known because it's very hard to distinguish because it's not as obvious to the visible eye. So now we understand the importance of perineal massage and pelvic floor release. Let's talk about how you're going to do it. So my recommendation is actually to start having an awareness of your pelvic floor as early on as possible. And this could even be pre-conception. I think everyone should have an understanding of what their baseline pelvic floor tone is, because some women have a very overactive pelvic floor, especially those with these predisposing factors like endometriosis or urinary tract infections, or a history of sexual trauma or impact trauma. And other women have a hypertonic pelvic floor. And this is because we often hold a lot of stress and tension in the pelvic floor. Much like we clench the jaw when we're stressed, it's really common for the pelvic floor to start tensing when you're stressed. And if you've ever seen a dog tuck its tail under when it's scared, you'll see that our natural response is to tuck the tail under when we're scared. And the pelvic floor is quite literally the extension of our tailbone. So imagine this is our tail. The tone of the pelvic floor, as I said, could be anywhere from overactive, hypertonic, and underactive or baseline. But it does really help to have an understanding of where you're naturally sitting on this spectrum early on during pregnancy. That means that you can have an ability to focus on contracting and relaxing, to practice exercises that are suitable to whatever your pelvic floor looks like. And you can discover this and work through this with a women's health physiotherapist. And then if we fast forward down the track, as you step into your third trimester, I do like to start focusing more on the relax phase. So more practicing relaxing the pelvic floor, which is what is needed for a natural vaginal birth. And then at around 34, 35 weeks, as the literature suggests, I recommend starting perineal massage. You've already experimented with your pelvic floor tone early in pregnancy, working in the hands of a women's health physio. They may have internally assessed your pelvic floor, or they may have gotten you to assess your pelvic floor internally. Unfortunately, the problem is by the time we get to 34 weeks, often the bump is so big that it's very hard to actually get down there and feel your own pelvic floor and perineum. So this is where, again, working with a women's health physio can be helpful, because they can guide you through and assess the specific tone areas that you need to work on. And then getting your partner involved. So men often, not all men, but unfortunately a lot of men are very unfamiliar with vaginal anatomy and the perineum, and this is very new to them. So often I have clients who get their partner to try the perineal massage. They've started the massage and it's been really uncomfortable or quite painful, so they've stopped. So it's really important to have good communication with your partner. I recommend, there's lots of different positions you can try it in, but I have found that the easiest position is laying not on your back, but having your back elevated by quite a few cushions so that you're semi-reclined. From here, you can have your legs apart and just gently rest your knees out to the side. You might like to have some cushions on either side. And then you'll invite your partner to separate the labia or come on internally onto the perineum. And then if you imagine the vagina, the entrance, as a clock face. Okay, so for you, looking down, the pubic bone is going to be up at 12 o'clock. The perineum is going to be 6 o'clock. Over the side is 3 o'clock and 9 o'clock. Now the pelvic floor, as I said, it's a horseshoe, so it mostly runs around from about 3 to 9 o'clock. So you'll instruct your partner to insert a finger vaginally and then start just by finding 3 o'clock. Apply gentle pressure to that side wall and you indicate what your pain level is out of 10. So this is going to be very individualized. For some women, it might be 10 out of 10. For others, it might be 2 out of 10. If they're pressing excruciatingly hard and it is out of 10 out of 10, communicate with your partner just to back off a little. Find that pressure that's anywhere between a 3 and a 5 out of 10. And then see if you can return awareness to your breath. So notice the gentle rise and fall of your belly, letting go of any tension. You're welcome to close your eyes down and really tune into that area of the pelvic floor. Focus on letting go and consciously relaxing that part of the pelvic floor and I guess the side of the perineum underneath your finger, or his finger. Then what you're going to do is completely relax the pelvic floor. And you might need to do a few contractions in order to feel this relaxation. So gently draw your pelvic floor up and in, and then feel the softening, feel the relax. Imagine that you have a full bladder and you are busting to go to the toilet, and finally you get to the toilet, and you let the pelvic floor go, and there's that sweet relief. That's the sensation I want you to feel, the pelvic floor contracting and then completely relaxing. Communicating with your partner, and over time, and this can be anywhere from 5 seconds to a minute, you should notice that pain underneath your finger, that pulling sensation or that 5 out of 10 pain dissipate and reduce to almost a 0 out of 10 and just a feeling of gentle pressure. What we are doing here is also communicating with the nervous system. So with that gentle pressure, there's a signal being sent up to the brain to say, this is safe, this is just pressure, this is just my partner, I'm in a comfortable, safe space. You are going to invite him to work all the way around that clock from 9 o'clock to 3 o'clock and focus especially around that perineal body. So pressing that perineum down, feel that gentle stretch, contract, relax, gentle belly breathing, and then allow all of that area to soften. And you might do this for a couple of minutes with your partner, making sure that you're using some sort of natural water-based lubricant, coconut oil, olive oil, or I use Olive and Bee, which is an Australian company. They have a really good range of natural water-based lubricants that's made out of beeswax and olive oil. So whatever you're using, make sure there is plenty of lubrication, that it's not painful. We don't want to stimulate a pain response. We are talking to the nervous system to say, this is not threatening, this is gentle, this is comfortable, this is pain-free. Things that you can add if you have time, having a bath beforehand will really relax your nervous system, will relax the muscles. Applying a warm compress, so just a warm wet towel, and then just applying that warm compress to the perineum, just like applying a heat pack before having a massage. It's just to relax that tissue even more. Now, much like you wouldn't go for a massage every day, we do want to wait for the pelvic floor to release in between. So I usually recommend only doing this depending on where you're at. If there is excruciating pain and you do need to work, then no more than every second day. But if you're working together and you're reducing those pain points and there's minimal pain, once or twice a week is sufficient. But you can see how it's really hard to make blanket statements because it's so individualized. And this is where identifying your pelvic floor tone early on and working with a women's health physio can be really helpful. Once you've worked all the way around the clock, you will basically repeat that next time in a few days' time, and you'll keep working on this, practicing your birth breathing techniques, anything that you've learned, practicing that relaxing of the pelvic floor. But sometimes we need to contract in order to feel that letting go, and then returning awareness to that belly breathing, feeling the gentle stretch of the pelvic floor as the diaphragm descends and recoils. So I hope this has been helpful. There is, if you have any concerns, if there is any bleeding or discharge, if you have any infection, then do check with your midwife or obstetrician before commencing perineal massage, or check with your women's health physio. Otherwise, I hope you found this information useful, and don't hesitate to get in contact if you do have any questions.